What if I told you that every 40 seconds someone dies from a heart attack? One out of every 5 individuals is younger than 40 years of age. These young, seemingly healthy hearts had their whole life ahead of them. So today, we're dissecting the anatomy of heart disease to understand why young people are dying of heart attacks and how to stop it before it attacks you. A heart attack or myocardial infarction occurs when blood flow to a part of the heart is suddenly blocked, usually by a clot sitting on top of a ruptured cholesterol plaque inside a coronary artery. This cuts off oxygen and nutrients to the heart and it starts dying within minutes. Your heart has a natural pacemaker that sends electric impulses traveling through an internal wiring to orchestrate every heartbeat. There are several deadly tricks to disrupt this symphony. The first and most common way to die in the first minutes of heart attack is arrhythmia. The electrical pathway gets disrupted, causing sudden cardiac arrest. If not shocked back into rhythm, you die instantly. And if the heart is too weak to pump blood, it can lead to dangerously low blood pressure, organ failure, and eventual death. Other complications include valve rupture, where a part of the heart literally bursts open. Most deaths occurs within the first hour of heart attack. That's why it is called the golden hour, when early intervention can save lives. Studies have shown that 5 to 10% of survivors develop life-threatening arrhythmia within just 48 hours of heart attack. You might be wondering, doctors must have some drugs to prevent this, but major trials like CAST trial reveal that prophylactic use of antiarrhythmic medication soon after a heart attack actually increases death. The heart's electrical system does not like to be played around. However, in high-risk patients, we often implant an ICD, implantable cardioverter defibrillator, and if the heart ever goes into a deadly rhythm, it shocks it back instantly. It's like having a personal paddles inside your chest. However, life after a heart attack is never the same as before. Daily medications, regular checkups, and lifelong risks. So it's wise to avoid a heart attack than to survive one. This brings us to the next big question. Are you at risk of a heart attack? The sad truth is, no one is completely immune. Even a child with anomalous arteries supplying the heart can have a heart attack. Heart attack is #1 cause of death worldwide. Though older age is a risk factor, there is an increasing trend of heart attacks in young adults. There are many contributory factors for this. Unhealthy lifestyle and physical inactivity have increased hypertension, diabetes, obesity, and high cholesterol, all fueling heart diseases. Harmful habits like smoking, vaping, and substance abuse, especially cocaine and cannabis, are also important contributory causes. During the course of evolution, humans have become the one species at highest risk of heart disease. Around 2 to 3 million years ago, our ancestor lost the CMAH gene, which produces sialic acid molecule called Nu5-GC. Let's call it GC for short. Sialic acids are sugar molecules found abundant across all vertebrates, which acts as entry point for infections and even has critical roles in brain development and even cancer. As these GC molecules help microorganisms to enter the human cell, loss of this gene likely offered an evolutionary advantage, protecting our human ancestor against then prevailing ape malaria, which also entered the human cell through these sialic molecules. Besides ancient survival, this gave humans enhanced brain growth and improved running endurance, traits that defined the rise of Homo sapiens. However, it came with the cost of reduced human fertility and increased heart diseases. Studies in mice engineered to mimic the human mutation showed double the amount of arterial plaque and surprisingly even higher risks when injected with GC-rich high-fat diet. What does this imply to us humans? Lack of GC is unique to humans, so it's one of the ways how our immune cells identifies human cells without GC molecules from non-human with GC molecules like that present in the red meat. As GC molecules are completely foreign to us, our immune cells form anti-GC antibodies that can cause inflammation leading to arterial plaque and heart attacks. Incorporation of GC-rich diet like red meat has been linked to heart disease, infertility, and even cancer. Our genetic legacy paired with modern habits hence creates the perfect recipe for many diseases. South Asians, including Indians and Nepalese, are at 3 to 5 times higher risks of heart disease compared to Caucasians. We tend to get heart attacks a decade earlier, hence genetics play a significant role. During human evolution, scarcity of food was a constant threat. To survive famine, our ancestors who could store fat more efficiently survived better. This led to the selection of what we call thrifty gene that makes us save energy. They were life-saving then, but same genes have now become liability in a world of excess calories and sedentary lifestyle. Not only efficiently, South Asians also store fat differently as visceral fats, that is, around organs, not just under the skin. This makes many of them metabolically obese, normal weight, looking thin from outside but fat from inside. They have 5 to 7% of higher total body fat at any given BMI compared to Caucasians. Hence, even at a healthy BMI, they have more organ fat, making such body measures inaccurate in predicting cardiac risks. People with same BMI or waist circumference, same age and gender can have very different levels of organ or visceral fat and therefore different disease risks. From actors to athletes, singers to comedians, we have lost many famous people to heart attack, reminding us that neither fame nor fitness can offer immunity. And South Asians die even younger. Nature protects females to some degree thanks to estrogen, but even that is lost after menopause. So, as all of us are at risk, how do you recognize a heart attack? The classic chest pain is a heavy, crushing sensation behind the breastbone that may radiate to arm, neck, or jaw. But some present with shortness of breath, cold sweat, nausea, or even just fatigue, with no chest pain at all. In women and diabetics, the symptoms can be even more subtle. So if you suspect a heart attack, don't wait to be sure. Call emergency services and get an EKG right away. So how do you prevent a heart attack in the first place? Control your blood pressure, normalize your blood sugar, and optimize your blood cholesterol level. Quitting smoking is one of the most powerful reversible risk factors. Avoid harmful use of alcohol and eat a heart-healthy diet rich in fruits, vegetables, and unsaturated fats. Manage stress through sleep and mindfulness. Exercise regularly, and if you have a family history of heart disease, consult your medical doctor. Prevention starts long before your heart sends out a signal. If you know the signs, respect the risks, and act fast, we don't just save hearts, we save lives. If this video helped you understand your heart better, give it a like, share it with someone you love, and subscribe for more life-saving insights. Thanks for watching. Till next time, keep beating, keep your heart healthy. This is Dr. Rehan signing off.